Hey everyone, I'm Dr. Soren Paape, one of the owners of Smile Now Dental Group. One of the questions we hear all of the time from new patients is, can I still get dental implants if I have medical conditions? Maybe you have diabetes, heart issues, high blood pressure, or you've just been told by another office that you're not a good candidate. Today, I want to clear the air and give you a straight answer. In this video, I'll explain which health conditions matter, what we look for before approving implant surgery, and why having medical issues doesn't automatically disqualify you from getting a healthy, confident smile. Let's dive in. Yes, you can still get dental implants even if you have medical conditions. We treat patients every day who have chronic conditions and still go on to have safe, successful procedures. The key isn't whether you have a diagnosis, it's whether that condition is controlled and stable. We don't look for perfect patients. We look for safe, manageable candidates, and we work closely with your doctor if needed to make sure you're cleared for treatment. Here are some of the most common medical conditions we see in our implant patients and how we approach them. Diabetes. If your blood sugar is well managed, you can absolutely be a candidate. We monitor healing closely and may modify your aftercare plan, but many of our diabetic patients do just fine with implants. Heart disease or high blood pressure. If your condition is stable and you're cleared by your cardiologist, implant surgery is usually very safe. We may adjust sedation options and medication protocols to fit your needs, but regardless, most patients in this category will be just fine with dental implants. Osteoporosis. Osteoporosis doesn't automatically rule you out, especially if you're not taking certain bone medications like IV bisphosphonates. We'll take 3D scans to evaluate your bone structure and adjust our surgical plan accordingly. Autoimmune disorders. Conditions like lupus, rheumatoid arthritis, or thyroid disorders are more common than you think. We take extra precautions to support your healing and avoid complications, but they don't necessarily exclude you from getting implants. There are a few medical conditions where we slow down and plan a little bit more carefully. Patients on blood thinners may need medications adjusted before surgery. Those with a history of radiation to the jaw require a more complex surgical plan. If you're on certain immune suppressing drugs, we may coordinate directly with your prescribing doctor. But in all of these cases, the conversation is never no. It's let's figure out the safest way to move forward. There's a big difference. Many offices simply don't have the tools or training to treat patients with medical complexity. At Smile Now Dental Group, we specialize in full arch implant cases, including those with chronic medical conditions. We use advanced imaging to minimize risk and plan with precision. All of our procedures are done in-house under one roof, so nothing gets lost in translation. And we have deep experience working alongside your medical team if needed. You don't need to bounce between providers or guess whether you're a candidate. We'll give you the real answer and a real plan. Here's what happens when you come to Smile Now with medical concerns. First, we start with a free consultation, a full health history, and a 3D scan. We identify any areas that need extra coordination or clearance. We develop a personalized treatment plan with your safety and long-term success in mind, and we follow through every step of the way. We're not just restoring teeth, we're restoring health, function, and confidence, and we take that very seriously. If you've been told you're not a candidate for dental implants because of a medical condition, or you're just unsure what's possible, we'd love to help. Click the link in the description to schedule a consultation at Smile Now Dental Group. We'll look at your case, answer your questions, and help you take the next steps with confidence. Thanks for watching, and make sure to check us out on Instagram. Bye-bye.